PGC is a medical society comprising of 5 arms of medical specialties, which are ophthalmology, dentistry, cardiology, gynecology, and pediatrics. General medicine and surgery is also provided for. These arms of the society will be set up to cater for special medical situations which require specialists' consultations. The size of each arm will be dependent on the number of medical staff appointed and the amount of patients that the arm can contain. The site seeks to pay a sort of tribute to the health service as a whole. Medicine has been a key part of the society which saved a large number of endangered lives and prevented a lot of medical problems from taking grasp in our societies. The health sector has since embarked on projects to educate the society on how to keep medical security intact and to research on various threats to the human life. The health sector has its own culture, which consists of special medical buildings, medical clothing, medical staff's values, various colors to show different arms of the health sector, among others. The planned medical society seeks to maintain and upgrade these values. The headquarters seeks to paint a clear picture of the various arms of medicine. For example, an eye-shaped building is the ophthalmology department. A tooth-shaped building is the dentistry department building. The medical personnel will also wear different colored clothing to show which department they operate under. The department buildings will also make up a single self-contained complex which will be accessible easily to the people around the community. The complex will also contain various helping arms of the medical department. These include radiology, pharmacy, media, research, awareness and education departments, among others. These will also help the patients to have access to medicine, services, and other key required offers to promote successful and effective treatment to the patients. The complex also should have a working and well-organized transport system. This will cater for the patients and the staff members to transport them where they are needed. These will include ambulances, reach-out vehicles, staff vehicles, as needed by the service. The specialist departments should also have separate admissions blocks so that the staff may have access to critical patients or patients with special medical complications. Since the society seeks to promote standards and specialist services to the society, the medical staff should be qualified and skilled. The society seeks to be a private one so that the staff will be chosen properly and qualitatively based on merit. Various specialists across the medical department will be consulted and proposed to become partners in the society, alongside medical doctors who are skilled in general medicine and surgery. Researchers, medicine experts, and surgery experts will also be preferred and proposed. The society seeks to have a specialized system of specialists as partners and the general medicine and surgery department as a single partner, which will be governed by a single skilled general medicine practitioner. Specialists will be partnered with accordingly and with respect to the availability and the size of the arm under which they operate. The general medicine and the surgery department seeks to be the biggest partner, since it is the one which is responsible for referring patients to various arms of the society. The society also should not be too big to avoid management complications, haste acts, and congested activities. Nurses will be recruited in various arms according to the need so that they can help in various ways. Other than the medical department, the society seeks to have other key arms which are key to the operation of the society. These may include finance department, radiology department, pharmacy department, maintenance and repairs departments, research and education department, media department, and the cleaning department. These will make the society operate normally, safely, and relevantly. The society also seeks to have a law department which protects, advises, inspects, and updates the society on the legal affairs both internally and externally. The medical society seeks to provide services that are not accessible to the people, which include specialist doctors' consultations, surgery, intensive patient treatment, education and awareness, research. In the medical field, a lot of new diseases and threats are being discovered as the world embraces technology and advancement. These threats and diseases require technological materials, highly educated doctors, and self-contained medical systems to provide lasting solutions. In a lot of communities, a hospital may have other sectors, but not all of them. This leads to various inconveniences and costly references to places where the services are offered. Where the services are offered, there is another problem again. There is a huge pressure to see the consultant. This leads to unnecessary loss of lives and worsening of already bad medical complications. This can be demonstrated in various forms. All this can be countered if such self-contained hospitals are established, at least if we have one hospital per district across the country. The society also seeks to provide a platform where skilled people across the medical globe can interact and come up with a focused research and service provision, which will give lasting solutions to various difficulties across the medical platforms. The society also seeks to leave families satisfied that it is only because of time and not negligence that a person will die. The society seeks to provide satisfying, long-lasting, life-changing, life-restoring services to the patients. Doctors are the witnesses of birth, death, and they also help to maintain life during the lifetime. Hence, a doctor is an all-weather friend who is mostly present at the hardest time in people's lives. The society will also help those who cannot afford to pay fees to consult specialists and special services, and will come up with various payment plans for those financially challenged. The hardest challenge expected will be the setting up of capital needed by the society to be erected. However, renting during the first days is a good idea. The society may also slowly get developed from a small surgery until all the arms are set up. When these arms are set up, the society can rent a single platform and slowly set up the complex as capital accumulates. The other challenge will also be the availability and the qualification of the required specialists. However, plans will be made in case of difficulties to engage already existing specialists and come to terms under certain conditions so that the offering of services won't be stopped. Funding of education for those who are interested will be also a good idea. Willingness and trust amongst the engaged partners may also be a challenge, which may create rifts in the operation of the society. However, long-time conditions and contracts will be applied to cater for such breakdowns and less engagement time allow the partners to have private time for private jobs.